When was the last time you had to cough really hard but you couldn't? Because you were in an important meeting. Or maybe you were trying to fall asleep, but your coughing fit just wouldn't stop. We understand that sometimes it feels like coughing is the only thing that you can do, and it seems impossible to control. But what if we told you that holding in your cough might be dangerous? Well, stick around to find out. In today's video, we will be answering one very important question. What happens if you hold in a cough? We will also explain what are the things that can happen if you try to stifle a cough and how to avoid them. So make sure to watch until the end. But first, if you're new here, make sure to hit that subscribe button for more videos like this in the future. And if you enjoy this video, don't forget to leave a like as well. With that said, let's get into it. Coughing is a reflex that occurs when the body's irritated by a foreign particle or pathogens in your airway. It's your body's way of protecting itself against any sort of damage from the outside world. There are many different types of coughs. However, most of them serve the same purpose: getting rid of unwanted substances in your windpipe and lungs. The act of coughing itself is a sudden gas escape from the lungs. This happens when there's a sudden relaxation of the muscles that are surrounding your windpipe. Doing this increases the air pressure within the lungs, which then gets abruptly released through the vocal cords. The result is the sound we all know as a cough. While coughing, you may also experience some other sensations such as pain in your chest or throat, or even nausea. On top of these physical symptoms, coughing can also cause emotional distress, especially when it becomes chronic. This means that coughing can affect a person's life in many ways. So you definitely want to take care of your body and not hold back your coughs, right? Well, not so fast. Depending on where you are and why you need to hold in your cough, stifling it may be a good idea. After all, you don't want to get in trouble at work or wake up your partner in the middle of the night. But doing this can have negative consequences for your health. Keep watching to learn about the possible dangers of holding in your cough. Stifling a cough can lead to ruptured eardrums. When you cough, the increased air pressure pushes through the eustachian tube to equalize the pressure on both sides of your eardrum. But if you hold in a cough, the pressure may build up and eventually cause a rupture of your eardrum. This usually causes a sharp pain in the ear and a ringing sensation. But it can also lead to hearing loss and an increased risk of infection. Holding in your cough can cause barotrauma. Barotrauma refers to injuries caused by an imbalance of air pressure on either side of your eardrums. As mentioned before, this can happen when you hold in your cough since the air pressure won't be able to push through the eustachian tube. This can also happen when you're scuba diving or flying, which is why it's recommended to swallow or yawn before takeoff or landing to allow the air pressure to equalize. Stifling a cough can cause lung collapse. This is known as a pulmonary embolism. When you inhale, the muscles between your ribs expand your lungs. If you hold in your breath, those muscles will tense up. Then when you exhale, those muscles will relax, and your lungs will shrink back into your chest cavity. In severe cases, this can cause a lung to completely deflate. While this is rare, it can occur in people who have pre-existing lung conditions and frequently hold in their breath. You could choke. You may have heard of George Washington choking on his food. Well, it might have been his dentures that were to blame. But regardless of what caused it, choking is a serious condition that can be fatal. This happens when your airway gets blocked and you cannot breathe. Holding in a cough can increase your risk of choking because it increases the air pressure in your esophagus. That air can then force its way into your stomach and block your airway. Choking is a medical emergency that requires immediate attention. So if it does happen to you, call 911 and get help fast. You may vomit. It's not uncommon to feel nauseous when you have a persistent cough. This is due to irritation of the airways and increased sensitivity of the stomach. Holding in a cough can worsen these feelings and eventually lead to vomiting. It's best to let the cough come out, rather than trying to hold it in. Otherwise, you may end up with stomach pain and possibly projectile vomiting. You can pass out. One of the more extreme side effects of holding in your breath is fainting. This can happen if you try to hold in a really bad cough. But it can also happen simply from the physical exertion of trying to hold in your breath. When you hold your breath, your body is deprived of oxygen. This can lead to lightheadedness and eventually unconsciousness. In some cases, holding in your breath can also cause hypoxia, which is when your body doesn't get enough oxygen. Hypoxia can cause cell damage, and in severe cases, it can lead to death. It may cause stress and anxiety. If you're in a situation where you feel like you have to hold in your cough, that can cause stress and anxiety. For example, imagine yourself in the middle of an important presentation at work, and you feel a coughing fit coming on. You try to hold it in, but the more you struggle, the worse it gets. Eventually, you end up coughing loudly and ruining your presentation. Situations like these can make you feel embarrassed and anxious. And if you're in a public place, others might stare at you or even laugh. This can cause you to become self-conscious and even develop a fear of going out in public. However, there are a few tips that you can follow to avoid these potential dangers. Drink plenty of fluids. Staying hydrated helps thin out mucus and irritants in your throat, making it less likely that you'll need to cough. But it can also help prevent infections that can cause coughing fits. Warm liquids such as herbal tea can soothe a sore throat and help reduce coughing. Use a humidifier. Dry air can irritate your throat and make coughing worse. Using a humidifier can add moisture to the air and help soothe your throat. This can be especially helpful at night when you're trying to sleep but your cough keeps you awake. You can also use a hot shower to achieve the same effect. Get plenty of rest. When you're tired, your immune system is more likely to get overwhelmed, and you're more likely to develop an infection. This can lead to coughing and other respiratory problems. So make sure to get at least 8 hours of sleep per night and take breaks when you're feeling fatigued. Practice good hygiene. Washing your hands frequently can help prevent infections that can cause coughing. It's especially important to wash your hands after being in public places or before eating. You should also avoid touching your face as this can introduce germs into your system. Quit smoking. If you smoke, it's time to quit. Smoking damages your lungs and makes you more susceptible to developing respiratory problems. It can also make your cough worse. Fortunately, there are resources available to help you quit smoking. Talk to your doctor about your options. So what happens if you hold in a cough? The answer is not much at first, but over time, it can cause some serious problems. It's always best to let your coughs come out as they can help clear out irritants and protect your lungs. However, there are situations where you may need to hold in your cough, such as during a job interview or in the middle of the night. If you must hold in your cough, make sure to do it for as short a time as possible. Otherwise, you could put yourself at risk of developing complications such as a ruptured eardrum, lung collapse, or even passing out. We hope you enjoyed this video. If so, make sure to leave a like and share it with your friends. If you have any questions or concerns, please leave them in the comments section below. We'll be happy to answer any questions you may have. Thanks for watching. Until next time.